Today we're wrapping up hyponatremia. Hypo meaning low, natri meaning sodium, and emia meaning in the blood. So sodium less than 135 microequivalents in the blood. Now, main causes that drain sodium from the body and into the body, we use the 4 Ds. So drains like NG tube, diuretics, diarrhea, as well as diaphoresis, profuse sweating. Simply all fluids that leave your body have some type of electrolytes. Because where fluids flow, electrolytes go. But the other causes of low sodium, we use the acronym SIADH. So the S is actually SIADH, syndrome of ineffective antidiuretic hormone. So if you guys remember, ADH means add DH2O for our acronym. Now, Spanish for yes is C. So yes, add the H2O. SIADH retains water, dilutes sodium in the blood, and so we have this low liquidy lab values called hemodilution. I stands for intoxication of water, so hemodilution again leading to low sodium, those low liquidy lab values. A stands for adrenal insufficiencies like adrenal crisis with our Addison's disease patients. Basically wastes sodium from the body and puts it in the body. D is for our diuretics like thiazides and loop diuretics, generic names for hydrochlorothiazide and furosemide. Both of these are considered potassium wasting as well as sodium wasting diuretics. Lastly, H is for heat exhaustion or high fever, which causes massive sweating, something called diaphoresis. Okay, signs and symptoms and nursing assessments for low sodium. Well, what's going on in hyponatremia? Well, it's low sodium, right? And since sodium is the queen of blood pressure and blood volume, well, then everything in the body should be depressed and deflated, right? Well, wrong. It actually depends on the type of hyponatremia. But the two main types are hypovolemic hyponatremia, basically a loss of fluid and sodium together, and hypervolemic hyponatremia, basically an increase of body water greater than sodium. Now, before you get too confused and start reconsidering your career choice, let's make this simple and really focus in on what the test will ask you. Now, what do you really think they're going to ask you? Well, prioritization, signs, and symptoms, of course. Who are you going to assess first? So write these down. We're going to go from mild to severe. Mild, you'll have fatigue, nausea, vomiting, and headache. Medium, general malaise or altered LOC, level of consciousness, as well as lethargy or basically weakness. Now, severe signs that you really have to prioritize and assess first are seizures, brainstem herniations, coma, respiratory arrest, which all lead to death. These are priority signs and symptoms that your test and your NCLEX will expect you guys to know. They'll ask what patient will the nurse see first. So guys, really pause this video, write those down because honestly they are very critical. Now here's a little hint for you. We have NCLEX prioritization and delegation questions in this next little video series here at simplenursing.com. So guys, please don't worry, I got you. Now for our general signs and symptoms. So in the heart, the cardiovascular system, vital signs will depend on the type of hyponatremia. If we have hypovolemic, basically low fluid and sodium, you'll have increased heart rate. Basically, the heart's trying to pump to provide fluids to the major organs. Decreased blood pressure, basically not enough fluid volume and no pressure in the veins, the vascular space. Increased respiratory rate because, again, not enough fluid, hence not enough oxygen, and the lungs are trying to compensate. Now, on the other side of the coin, if you have hypervolemic, high fluid, you'll have increased heart rate because too much fluid, the heart will try to pump harder to push out that fluid. There'll be increased blood pressure because of all that fluid in the vascular spaces, and decreased respirations, difficulty breathing due to that fluid volume overload, putting all that pressure on the lungs. As far as EKGs, there'll be cardiac dysrhythmias, ST elevations on the ECG, because the ventricles are cramping up and not relaxing or repolarizing, basically not recharging. For the lungs, there'll be shortness of breath and dyspnea, known as difficulty breathing, GI, nausea, vomiting, and abdominal cramping. Neurologically, your brain and spinal cord, you'll have restlessness and confusion, which will lead to seizures and comas. And the muscles, you'll have general weakness. So nursing interventions for low sodium hyponatremia. So guys, what are we going to do about it? Well, it's a simple fix, really. We just add salt. We use actually the acronym add salt. So A, we administer IV saline solution. But caution, it depends on what type of hyponatremia we have. If we have hypovolemic hyponatremia, the body has this low fluid, so isotonic solutions like normal saline or lactated ringers. For hypervolemic hyponatremia, we have high fluids, so guys, we're not going to give IV fluids. We'll just do water retention and furosemide, our loop diuretics. Now, only for severe cases in both conditions, we use a very super salty hypertonic solution like 3% saline. It's very thick. And it puts salt back in your body very quickly. So D stands for diuretics or dialysis, especially true for hypervolemic hyponatremia, that high fluid volume. So diuretics will get all that extra water out of the body and into the body. Now, if your patient's kidneys are broken, like in renal failure, we'll use the backup kidney, our dialysis machine, to suck out all that excess fluids. D stands for daily weights. So remember, where sodium goes, water flows. So infusing a lot of sodium will cause weight gain and this edema, basically making your skin look like a waterbed. So please watch for that as a nurse. S stands for safety. Our patients with low sodium have huge risk for falls. So use fall precautions. And this is pretty much due to orthostatic hypotension, which is that low blood pressure upon standing. So a huge risk for passing out and falling. A stands for airway precaution. So your patient will be on NPO, nothing per oral. Your patient's probably confused, and the last thing you really need is a choking patient. So guys, airway precautions, NPO. L is for limit the water intake. For patients with hypervolemic hyponatremia, guys, they're already water-filled and fluid-filled, so stop that water. T is for teach. So foods high in salt, like canned foods, processed meats and cheeses, anything packaged, or basically the diet of any normal nursing students. But am I right though, huh? I'm right there. All right, here's a list that students usually don't think about and end up getting wrong on their exams. Salad dressing, soy sauces, any type of sauce or seasoning, vegetable juices, especially those canned like tomato juices like V8, and even Chinese foods or cup of noodle soup.
Oh wait, what, this? Oh, come on, man! This is all I can afford after my tuition. I mean, I could be hyponatremic, you never know.
All right, guys, that wraps up our lesson here. We'll see you in the next video.